محاضرتنا بها two parts: the anatomy and radiology of the ear and the anatomy and radiology of the neck vessel. البارت الأول ear, the anatomy of the ear. ear تتألف من three parts: external ear, middle ear and the internal ear. external ear تتألف لنا من two parts: البينا and the external auditory canal. هذه بعدها البينا اللي هو الجزء المحسوس اللي نقدر كليتنا نتلمسه، يتألف من anatomical landmark اللي هو أول شيء اللوبيول، التراجاس وأنتي تراجاس، الهيليكس وأنتي هيليكس والفصة triangularis. هذه the first part of the external ear. second part اللي هو external auditory canal. external auditory canal, it is a 3.5 cm long, lined with the skin. Outer 1/3 is cartilaginous, while the inner 2/3 is bony, and medially with a tympanic membrane or the eardrum. تمام؟ eardrum, it is a circular in shape. هذا واضح بالصورة. يتألف من pars flaccida and pars tensa, الإنكاس and annulus. وهو احنا نتخيله لازق عليه المالياس، لذلك الاناتومي of the malleus will appear on the tympanic membrane. So the umbu in the center and the manibarium of the malleus and the short process of the malleus. This is a radiological image showing the external auditory canal anatomy. اللي على يسار الشاشة نبدي من البينا واضحة، بعدين الاكسترنال auditory canal الأول بارت قلنا إنه هو cartilaginous، بعدين بوني، وهذا السهم الأرو الدبل أرو هذا هو tympanic membrane، بعده تجي middle ear. تمام؟ الصورة الثانية أيضا هذه الاكسترنال auditory canal، الكارتيليجينيوس بارت والبوني بارت والتيمبانيك membrane. This is a case of otitis externa in which a patient 7 years old presents with fever and left ear swelling, tenderness and erythema. On CT scan, this showing the normal in which the external auditory canal and the eardrum all are intact, while here the soft tissue, there's a soft tissue attenuation, and there's a material with external auditory canal, abnormal enhancement, the canal is obliterated. This is a case of otitis externa and how it appears on CT. Now the middle ear anatomy. The middle ear, it is a slit-like cavity that houses in the petrous bone. Laterally, there is tympanic membrane, and medially, the inner ear. هذه هي middle ear واضحة, laterally tympanic membrane, وmedially inner ear. It is a room-like cavity, يعني بها 6 walls. We have a superior, inferior, anterior, posterior, medial, and lateral. So the boundaries of the middle ear عندنا 6 شغلات هي boundaries of the middle ear كأنما إحنا واقفين بغرفة بها 6 جدران. Superiorly عندنا tegment tympani. Inferiorly, a plate of bone below in which there is a jugular bulb. Lateral, a tympanic membrane. Medially is the inner ear. Anterior, the internal carotid artery. And posterior, the mastoid antrum. هذه الصورة توضح الروم لايك كافيتي اللي تشبه الميدل اير. الجهة اللي ما موجودة هو التيمبانيك ممبرين اللي هي اللاترال سايد. So قدامنا صاير الميديال سايد اللي هو الانر وول of the inner ear. Anterior قلنا الانترنال carotid artery, posterior الماستويد ear cell, superior tegment tympani, and inferior jugular vein. The structure of the middle ear. In the middle ear, we have bone, we have muscles, and we have a connection. شوف هنا in the middle ear, there is an opening in the posterior wall of the middle ear. اسمه entrance the mastoid. This opening will connect the inner ear with the mastoid ear cell. Also, we have what we call it the otic or epitympanic recess. This recess present in the superior part of the middle ear, and it is above the tympanic membrane. الشغلة الأخرى أكو شيء اسمه tegment tympani. Tegment tympani, it is a bone in which separate the middle cavity from the temporal lobe of the brain. Also, we have what we call it the Otitis Externa مثل ما قلنا opening موجودة بالposterior wall of the middle ear and connect the middle ear with the mastoid ear cell. وعندنا في شيء اسمه السكتم. هذا السكتم المؤشر بالأحمر. طبعا قاعد أسوي زومينج. واضح ده يطلع الزوم؟
اي واضح واضح.
هذا الأدوتس السكتم it is a bony sphere in which the tympanic membrane is attached. هذا البون الصغير اسمه السكتم. الميديال wall of the middle ear. الميديال wall of the middle ear كأنما نتخيل أنه هو لازق على inner ear. So some structure of the inner ear will appear in the wall. نشوف هذا أول واحد. هذه البروميننس. Prominence is due to the lateral semicircular canal. هذا the upper part. The lower part عندنا promontory due to the cochlea لأنه inner ear structure لازقة ويا middle ear so راح تظهر لنا خلال الوال. عندنا أيضا a prominence of facial canal وعندنا two window, the round window and the oval window. The round window هاي هي round window اللي هي below and behind and the oval window below behind the promontory and above in which the stapes is attached. We have ossicle, three ossicle in the middle ear, malleus, incus, and stapes. The malleus consists of head, neck, anterior process, and lateral process, and handle. This will articulate with the incus. The incus composed of body, short process, long process, and lenticular process. And the incus will articulate with the stapes that compose from head and anterior and posterior crest and foot plates. The muscle of the middle ear, we have two muscles. We have tensor tympani and we have stapedius muscle. The tensor tympani originates from the cartilaginous part of the Eustachian tube and insert in the upper part of the handle of the malleus. The action is tensing the tympanic membrane to reduce the force of vibration in response to loud noise. So it is a protective muscle. Other muscle is stapedius, originating from the pyramid eminence and insert to the neck of the stapes. The action pulls the stapes posteriorly and prevent the excessive oscillation due to loud noise. The other component of the middle ear is the Eustachian tube. The Eustachian tube, it is 3.5 cm long bone that connects the middle ear with the nasopharynx. هذا يكون عكس external ear. It is bony at first and cartilaginous in its lower portion وهذه واضحة بالصورة. هذا هو الأوستيكين تيوب. هاي middle ear cavity بالinferior part الأوستيكين تيوب. أيضا هذه الصورة الأوستيكين تيوب bilateral connect the middle ear to the nasopharynx. So as a revision سريع للmiddle ear, it is a room-like cavity. We have 6 walls, laterally tympanic membrane, medially an inner wall, superiorly a bone that's separated from the brain, and inferiorly the jugular bulb, anteriorly the internal carotid artery, and posteriorly the mastoid ear cell. لأن عندنا bones وعندنا muscle. Now the third part of the ear, which is the inner ear. The inner ear consists of bony and membranous part. Membranous part, it is a fluid-filled sac that concerned with the hearing and balance, lie in the petrous bone medial to the middle ear. هذه هي inner ear. This picture showing the component of the inner ear. This is the bony part, and inside it there is a membranous part. We have 3 semicircular ducts, anterior, lateral, and posterior. We have the cochlear duct and vestibular duct, the tympanic duct. This is cochlea and utricle and saccule. This is another picture for the inner ear. This picture showing only the membranous part of the inner ear, the three semicircular canal, the utricle saccule, the cochlea, and endolymphatic duct. We have a structure what's called an internal auditory meatus. Internal auditory meatus, it is a bony canal 1 cm long, transmit the 7th and 8th from the posterior cranial fossa. هذه هي نشوفها تأزومها. هذه هي internal auditory canal. طبعا internal auditory canal consists from anterior and posterior parts. هذه هنا هي مو canal واحدة بها 4 opening, anterior and posterior. From the anterior part, the facial nerve and the cochlear nerve will pass. The facial nerve is anterior superior, while the cochlear nerve is anterior inferior. In the posterior part of the canal, the vestibular nerve, the superior part, and posterior inferior, it is the vestibular nerve inferior part. Okay? The facial nerve. The facial nerve has 4 segments. The first one, 8 to 10 millimeter, which is a meatal segment. Inside the meatus, labyrinthine segment, which is 4 millimeter, tympanic segment, 11 millimeter, and mastoid segment, 13 millimeter. We mentioned here because the third part of the facial nerve causes prominence on the medial wall between the prominence of the lateral semicircular canal and the promontory, then turn down in the posterior wall and exit through the stenomastoid foramen. هذه الصورة الفيشال nerve واضح. سوينا prominence بالmedial wall of the inner ear and then pass to exit from the mastoid opening. Till here, we finish the ear. Revision سريع. We have 3 parts, external, middle, and internal. External بها 2 parts, pinna and external auditory canal. The middle ear, it is a room-like structure. بها tympanic membrane, بها muscle and bones. The boundary, superior tegment tympani, inferior jugular bulb, anterior internal carotid artery, medial, the inner ear, lateral tympanic membrane. And also we talked about the inner ear, which composed of 2 parts, bony and membranous. So questions غيروني. هذا CT scan and هاي عندنا هنا اللاند مارك. تقدرون تجاوبوني شنو هاي الأرقام يعني التريا ستراكشر. رقم 1.
انت شرحيها لانه شوي الصوره مو كلش واضحه.
تمام.
وصغيره طالعه عندنا، يعني بالنسبه لي يم صغيره.
تمام. اوكي. رقم 1 هو البينا. رقم 2 هو الماستويد اير سيل. رقم 3 هو الاكسترنال auditory canal. The membranous part of the external auditory canal. رقم 5 هو البوني part of the external auditory canal. ورقم 6 هو tympanic membrane. تمام؟ خلصنا البارت الأول من المحاضرة اللي هو الإير. البارت الثاني هو الاناتومي and radiology of the vessel of the neck. We will start by the carotid arteries. The carotid arteries in the neck, we have 2 arteries, the left and right. يختلفون بالأوريجين مالتهم، لكن بعد نقطة معينة راح يصيرون يمشون نفس الكورس. So the origin of the left common carotid artery arises from the aortic arch directly in front of the trachea and pass across this to lie on its left side in the root of the neck. While the right common carotid artery arises from the brachiocephalic trunk behind the right sternoclavicular joint. From this point, the vessel have a similar course. هذه الصورة توضح الأوريجين of the common carotid artery, the right and the left. قلنا إنه الرايت يطلع لنا من البريكيوسيفاليك while the left directly from the aortic arch. The common carotid artery pass upward and slightly laterally. It is accompanied by internal jugular vein on its lateral aspect with the vagus nerve lying posteriorly between the two, and all the structure invested in the carotid sheath. This picture showing the three structure. This is the carotid sheath. Medially, the common carotid artery. Laterally, the internal jugular vein, and between them is the vagus nerve. The carotid arteries, the common carotid artery bifurcate into external and internal at the level of C4. The external carotid artery passes anteriorly and curves slightly posteriorly as it ascends to enter the parotid gland, where it terminates by dividing into maxillary and superficial temporal artery. هذه الصورة توضح الكمان carotid artery راح يصير به bifurcation at the level of the C4 into external and internal. The external will enter the substance of the parotid gland and terminate as superficial temporal artery and maxillary artery. While the internal carotid artery continues superiorly to the base of the skull, maintaining the relation with the internal jugular vein and the vagus nerve. The internal carotid artery has a localized dilatation in its origin called the carotid sinus. While the internal carotid artery has no branch in the neck. Now, the anatomical relation of the common carotid artery within the carotid sheath. Posteriorly, the sympathetic trunk. Medially, the trachea and esophagus, with recurrent laryngeal nerve between them at first. At higher level, the larynx and pharynx and recurrent laryngeal nerve are medial, with the thyroid gland lying anterior medially. Anterior laterally, it is covered by sternocleidomastoid and strap muscle at first. Above the level of the cricoid cartilage, it is covered only by skin and fascia, وهي هاي النقطة اللي احنا كلنا نتحسس بها pulsation of the carotid artery. Now, the anatomical relation of the internal carotid artery within the carotid sheath داخل الشيث نفسها. Posteriorly, there is sympathetic trunk and perivertebral muscle and the transverse process of C1, C3. Medially is the lateral wall of the pharynx. Anterolaterally is covered through its length by sternocleidomastoid. The styloid process and its muscle will separate the internal carotid artery from the external carotid artery. The internal carotid artery becomes anterior to the internal jugular vein at the base of the skull and will enter through the carotid canal, while the internal jugular vein and vagus nerve will pass through the jugular foramen. Now, the anatomical relation of the external carotid artery. The external carotid artery, medially to it is the lateral wall of the pharynx at first, and at higher level, it is separated from the internal carotid artery by the styloid process and its muscle. Anterior-laterally, it is the anterior part of the sternocleidomastoid at first, and then pass deep to the posterior belly of digastric and the stylohyoid muscle before entering the substance of the parotid gland. The external carotid artery has 8 branches. عكس الانترنال، قلنا الانترنال ما عنده أي branch during its course in neck. While the external has 8 branches. The first one is superior thyroid, second ascending pharyngeal, third lingual, fourth facial, fifth occipital, posterior auricular, maxillary, and the superficial temporal. This is another picture that's showing the branch of the external carotid artery, the superior thyroid artery, ascending pharyngeal, lingual, facial, occipital, superficial temporal, and maxillary artery. The radiology of the carotid vessels. The first radiological image we can get through the ultrasound when we use the high frequency probe. We can examine the common carotid artery and the external and internal. During ultrasound, we can see the inner wall of the arteries, the intima thickness, any pathology, any clot, any fatty droplets we can see here. Also, we can use angiography as imaging. The carotid vessel may be demonstrated by injection of contrast through a catheter in the aortic arch or by selective injection of either vessel. يعني نقدر احنا نسوي انجكشن يا اما الكمان carotid artery او يا اما الاكسترنال او الانترنال. هاي البيكتشر showing MR angiogram A and B is CT angiogram. Here we have a 72-year-old man suspected carotid artery disease. Picture A, the big arrow showing a stenosis in the proximal left internal carotid artery and the distal left vertebral artery. واضحة عندكم الصورة؟ up narrowing؟
اي واضحة واضحة كلش.
تمام. B, there is a narrowing in the vertebral artery. The arrow showing the narrowing. Now, the subclavian arteries in the neck. So we finished the common carotid artery and its branch, the external and internal. Also, we have two arteries, the right and left subclavian artery. نفس الشيء, they are different in their origin, لكن بعد نقطة معينة they will have the same course. The right subclavian artery arises from the bifurcation of the brachiocephalic trunk behind the right sternoclavicular joint, while the left subclavian artery arises from the arc of the aorta in front of the trachea at the level of T3, T4 disc space. It ascends behind the left sternocleidomastoid sternoclavicular joint. From this point, both arteries have similar course. هذه الصورة توضح الأوريجين of the subclavian artery, the right direct from the brachiocephalic and the left directly from the aortic arch. The scalenus anterior muscle will divide subclavian artery into three parts: first, second, and third. The first part, the second part is behind the scalenus anterior muscle. The first part of the subclavian artery the four branches. The first one is the vertebral artery. Second one is the internal thoracic artery, thyrocervical trunk, and costocervical trunk. While the branch of the second part is the costocervical artery, while the branch of the third part is the dorsal scapular artery. Now we will discuss the veins, the jugular veins. The internal jugular vein is formed at the jugular foramen, where it is a continuation of the sigmoid sinus. It descends in the carotid sheath lateral to artery, then pass anteriorly to behind the medial end of the clavicle, where it is joined by the subclavian vein to become the brachiocephalic vein. The external jugular vein descends superficial to the sternomastoid muscle and pairs the cervical fascia above the midpoint of the clavicle to the subclavian vein. هذه الصورة توضح the internal and external jugular vein. The external jugular vein, this is a direct continuation from the sigmoid sinus, and the external jugular vein will enter and praise the subclavian vein. Also, we have what we call the anterior jugular vein. It arises at the level of the hyoid bone near the midline. It passes downward and laterally, passing deep to the sternomastoid to enter the external jugular vein behind the clavicle. The jugular arch is the U-shaped communication between the two anterior jugular vein above the meniberium sterni. هذه الصورة توضح the anterior jugular vein in which drain in the external jugular vein and the jugular arch which is U-shaped, and it is a communication of both veins. The vertebral vein. The vertebral vein exits from the transverse foramen of C6 and runs downward and forward to drain into the posterior aspect of the brachiocephalic vein. هذه الصورة توضح the vertebral vein, and when it is entered the posterior aspect, the brachiocephalic vein. The subclavian vein. The subclavian vein is the continuation of the axillary vein from the outer border of the first rib to where they join the internal jugular and form the brachiocephalic vein. هذه الصورة توضح ال axillary vein continuation راح يصير عندنا subclavian vein. Radiology of the vein of the neck. The neck vein are identified on cross-section image technique using ultrasound, CT, and MRI. The subclavian arteries are best demonstrated by angiography, CT, or MR angiography, while the subclavian vein are best demonstrated by venography, with injection into one of the vein in the arm by CT angiograph with contrast, or by MR angiograph with contrast, without contrast. هذه الصورة هي MR angiography. أني ما أعرف تطلع واضحة والحلول هي موجودة. رقم 1 هو البراكيوسيفاليك trunk, the brachiocephalic trunk. رقم 2 right subclavian artery. رقم 3 the right common carotid artery. رقم 4 right vertebral artery. 5 the right external carotid artery. 6 right internal carotid artery. Thank you very much.
شكرا دكتورة ياسمين.